Ahmed Kouta is a Palestinian nurse who was in Gaza until June, documenting the crimes in the north of the enclave. He joins us live now from Ontario, Canada. Thanks very much for being with us. So just tell us, first of all, a little bit more about what you observed during your time in Gaza.
Hello, thank you for having me on this live show. So the situation in Gaza every single day would get very much worse. At the very beginning, the situation, it was something Gazans never seen something like this. Every month we go in is like a new chapter with every day as an episode, to the extent of disasters and massacres that can be happening. Up until I left Gaza, we were living the worst days of our lives, the worst days we can imagine. Every day it just gets worse, as we see every single day new evacuation orders for people living already in places that have already been invaded. Yesterday we've seen a video of people when sudden evacuation for Khan Yunis, people were going out from homes that are already destroyed. So the situation, like, there is no place in Gaza that is safe. They ask everybody to go to safe zones, and all these safe zones are places that have already been invaded, and they're invading them each time they ask for a safe zone. There's nothing safe in Gaza for anybody to even be at.
Tell us a bit more about what you saw personally in your time there, and the kind of work that you and your colleagues were doing while you were there.
As I was there most of the time, at the very beginning, we were at the Shifa hospital before it was invaded. The injuries and wounds we were seeing, they were never something that we've studied. They were never anything we've done in any clinical program that anybody should endure. A lot of stuff we had to experience on the very first time seeing this. Even though Gaza seen massacres and seen wounds that are this severe, at times in the operation rooms, there would be patients that would go into priority. So if a patient entering an operation room had a chance of not making it, then they won't be allowing him to enter the operating room. They would allow patients that there's a chance of them being alive. Once a house is destroyed, and we're there to, like, when we're off our shifts, when we're there to want to get people from under the rubble of a house, we're not able to do that because there is no equipment for the civil defense forces. The normal people start going into entering these houses. Every single day you would hear noises of people at night screaming from being under the rubble for the first day, second day, and then eventually their voices are gone because they would die, because there is nobody there to be able to get them. As the Shifa hospital was invaded, the system of the health sector has completely collapsed because the Shifa hospital is the heart of hospitals, as the heart of the health system in Gaza. Now, as you can see in the videos that are being uplifted, even through the screen that I'm seeing right now, the people are carrying patients to the hospital without any ambulances, without any resources that are supposed to be used as an international standard. We've been using donkey carts and bikes and people just to carry patients from injured site to the ER, to the hospitals. A lot of injuries, a lot of cases, and patients would be on the floor, being treated on the floor. All the bloods would be all mixed together, which increases the chance for people to have diseases, as their blood is all being mixed all together. A lot of times we won't have any time to even have anything personal for ourselves. I remember one time I was supposed to have just a break to do a prayer, and some of the patients, they were there, they said, please just don't pray right now, just there's a case that you should be seeing. And the time that you never had for yourself, or the amount of patients that would come in whenever there's an airstrike, we always put our hands on our heart. We're always afraid because we know that the hospital right now is going to be very chaotic, and the biggest fear that you would have is that somebody that you know comes in, your family member, your relatives, colleagues, relatives, your family members. That was the biggest fearful and stressful moment. Whenever an ambulance comes in, we would be very afraid, because we would have an idea of, we know what these injuries are like, and we don't want any of our beloved ones to be there. Yes, everybody in Gaza is family. Everybody in Gaza is beloved to us and very dear. All these children and elderly people that are that are normal civilians, that they have nothing to do with what's going on. They're just the ones that are being targeted. the situation really, it's very, very difficult to describe as much as we can talk about it or describe and say to the world what's going on and what's happening in Gaza. I think we've showed more than enough to what's happening. I think everybody in Gaza has been injured at least once in the past 11 months that's going on. You're talking about almost over 2 million people all injured in the span of 11 months due to the airstrikes that Israel is attacking on Gaza.
You talk there about trying to get the message out to the outside world about the suffering of Palestinians in Gaza. And we are now 10, 11 months into this conflict. Do you feel that that message is getting out and it's getting out to the right people?
I believe the message has been reached to the world the very first couple months, and I believe everybody has seen what's happened, but there's people that just choose to close their eyes to the truth that's happening. And there's a lot of people that already have spoken up. We really appreciate the world for trying their best to move, but however, the people that have power to stop what's happening, they are unfortunately supporting the genocide against Gaza, and the people that are in Gaza, being in Gaza and seeing the situation that, like, you've lived all these horrible scenes and massacres with everybody there. It's very hard just to ask the message to be sent out to the world. I believe everybody has a thought of what's happening in Gaza, but the message that we want right now is to stop what's happening right now, to ask for a permanent ceasefire, not just for a couple of days like it happened in November, and after that they came a lot more worse massacres with what's been happening. So our message is not just for people to see what's happening, it's for people to stop what's happening, because it's very unfortunate the amount of people that are dying every day. A lot of massacres, a lot of people are dying from different sources of other than being targeted by an airstrike due to the occupation in Gaza, due to the severity of not allowing any resources in, and that causes a lot of other deaths other than being directly air targeted. So we ask the world not to just see our sufferers, but to also interfere and stop what's happening.
Ahmed Kouta, good to talk to you.